state of public health in Canada, I think it's actually strong. I think they're stressed, particularly as we're talking about sort of H1 following on a listeria, our capacity being thin, and it being noted by Naylor that we can deal with one crisis at a time, but when two crises or two issues hit us, this is problematic. But I do think that do we have a high level of visibility, that we have opportunities to move forward, that we've never actually been as strong from a sort of scientific perspective or had sort of such a sense of regrowth or rebirth.
The current state of public health in Canada is of genuine concern. It's very, very easy to say that we've got the best people, and we do, that we've ever had working in the public health workforce. The best educated, those with very serious use of the evidence and with good intent. But we have totally insufficient resources in all the domains, not only in terms of the resources to do one's work, but the political support to actually do what we want.
I think the public health sector in Canada right now is at a crossroads, because we went through a period when public health was really falling apart, and that culminated in the SARS outbreak and several other outbreaks, and that led to the Naylor report and to the requirement to really reinvigorate public health. And to some extent we've done some of that, but if you look at where public health sits within the hierarchy of the health authorities, and by and large now it's moved within health authorities, it's still a bit player. It's still around 3% of the budget. It still doesn't get a lot of respect. It's still raided for its funds when the acute care sector needs it. It's a constant struggle. We have high levels of inequality, and of course high levels of inequality increase the burden of disease, increase the burden on the healthcare system, as well as, of course, making a lot of people sick and miserable and unhappy, and resulting in a lot of premature death.
I'm so impressed with a lot of the young people that are there. I think they're much better prepared for their work than we were. Public health has come a long way as far as the educational side, I think. And they're so committed and enthusiastic that I think there are a lot of great future leaders there, for sure.
University training programs for our nurses, our medical health officers, our environmental health officers, is the absolute best that they've ever been. The quality of people that they're turning out, and the younger people than we used to have in public health, is really making it a great thing. So I think public health today is at a great peak, and I think it will simply continue as it gets recognized for AIDS, for SARS, and for H1N1, that it is a highly professional part of the medical nursing continuum.
Where we are now in public health in Canada is better than we've been for a long time, in terms of resources, in terms of capacity, but we have a long way still to go.
I think the greatest need today in public health is for resource reallocation. I'm actually very fatigued to see us here in 2010 spending so little resource on public health. When you look at a health envelope and you say 2% of the monies we spend in the health system, we spend on public health, you know that there's an issue, that there's a problem. We have evidence of what we can accomplish if we were comprehensive, coordinated, and thoughtful about how we encouraged and provided capacity to people to remain healthy. And yet, for some reason, we've been unable to move this mark so that we actually empower people to make the decisions they need to make in order to remain healthy. And I don't see this as a personal choice issue. I see it as an issue of the environment that we've created and how do we empower people to understand how to interact with that environment.
It's interesting, I think, to see that Canada, in terms of oral health, is quite well respected internationally. We're presently the chair of the International Chief Dental Officers, which is the World Dental Federation, has about 140 chief dental officers. And for some reason, they seem to like Canada. Either that or nobody else wants to do the job. But it's nice to have our office at Health Canada part of that and chairing that group. It's a 1-year renewable term, and actually this is our 4th year we've been asked to do it.
We're still the second sister in the healthcare system. We're still underfunded. And historically, public health has always been, when there's an epidemic, the money is there. When the epidemic is over, the money is gone. There's never been a really good understanding in the political arena and even in the public arena of the importance of a strong public health system. So we've got a ways to go. We've made some progress for sure, but clearly we've got a ways to go.
The sector's way too small still. I doubt very much that 3% or whatever it currently is of the Canadian health dollar is the amount that we ought to be spending on public health. It ought to be a much higher proportion. And that's probably reflected in some of the problems we're having in dealing with a big problem like the H1N1 that is currently upon us. The sector's always under strain. It's not big enough. But as far as I think you said the professionals, it's way better than it was. I got into this field now roughly 40 years ago. Compared to then, we now have way more professionals, and they're much better trained. They have much better opportunities for training. We finally have more schools of public health, and we have many more graduate programs in public health disciplines than we had, and in population health as well. So I think the people are both more numerous and much better trained. We have vastly better health statistics. When I started 40 years ago, the only information we had on, the only survey data we had on the health of the population was something called the Canada Sickness Survey of 1950-51. This was sort of 1970 or so, 20 years old already, and grossly inadequate. We didn't have good statistics from what we now call administrative data, like the healthcare system utilization of doctors and hospitals and the like. We didn't have a heck of a lot. We didn't, I think at that point, we didn't even have a cancer registry in every province. And so the range and quality of the statistics available are incomparably better. And we also have the Public Health Agency federally and in several provinces. So organizationally, I think we're stronger.
With the professions involved in public health in Canada. I was blessed as a CPHA for the Canadian Public Health Association to have several thousand members in the association who were public health professionals who belonged to the association. And over a long period of time, over a 30-year period of time, I really began to understand how committed and passionate public health professionals are. We had professionals who left their jobs and agreed to work in committees and advisory programs and strategic programming, not only in Canada but throughout the world in some of the most difficult areas, addressing AIDS issues and capacity issues of rebuilding organizations. And this is free time given to them. They are the best in the business, the public health professionals. I have tremendous respect for those people who decided to choose to work in public health. It certainly isn't the most financially rewarding position in the health sector, but the satisfaction that individuals get in public health individually is most rewarding, and I have tremendous respect for public health professionals. They are really the true professionals in the country in the health sector.